Now, I know this has been explained to you people literally hundreds of times on this app alone, but for some reason it's failing to compute, right? It's hard for you to compute this. So I don't know what else to do except maybe try like visual aids. So this is how healthcare works in a US style system, right? Okay, so there's the citizens, and the citizens will pay taxes towards a public health infrastructure. You are paying taxes for healthcare in the US system, and these taxes go towards, Medicare, Medicaid, public health infrastructure, public hospitals that will treat anybody regardless of insurance, people who can't afford to pay for their own healthcare, right? That's what your taxes are going towards. This is the stuff that makes you mad, taxes. So you are paying taxes in a US system, but then you're going to pay premiums. Now, premiums are what you pay monthly just to get in the door of insurance, right? Like this is what you pay just to have the right to insurance, okay? Now, you'd think that paying premiums would mean that you have health insurance and that your health care is covered, right? Wrong. Once you've paid premiums, then you also need to pay deductibles. And depending on how much you've paid for your premium, the deductible could be high or low. And a deductible is what you have to pay out of pocket before your insurance even kicks in. So if you have like a low premium, you could have like a $2,500 to even like a $5,000 deductible. And that's what you have to pay. You'd have to pay like $5,000 out of pocket before your insurance even kicks in. Once your insurance kicks in, you'd think that after premiums and deductibles, then your insurance is just going to pay for your health care. But no, then you have something called co-insurance, depending once again on your premium and your deductible. Your co-insurance means that your insurance company will pay a percentage of what you owe after the deductible. So it's usually like 80-20 or 70-30. So now you've paid taxes for a public health infrastructure, you've paid your premium to get your insurance, you've gone out of pocket through your deductible, and you still owe 20 to 30% of your hospital bill based on your coinsurance. And then after all that, you get access to healthcare. That's how a US system works. All these blockages before you actually get to your healthcare. This is how it works in a universal healthcare system, right? You have the citizens, and the citizens pay taxes to a public health infrastructure, and then they get healthcare. And that's it. Citizens pay taxes, citizens get healthcare. Now, once again, you're paying taxes in both systems, but in the US system, your taxes generally go towards people who can't afford their health care. And in a universal healthcare system, your taxes go towards everybody, including yourself. This is the one that you're arguing for of the two. And after paying all this, you get access to a US health system that ranks 37th in the world.